Welcome back. I hope you had a good health break. I'm Clara MacKay, CEO of the World Ovarian Cancer Coalition, and I'm joined for this session called Charting Our Course for the Future with a number of really interesting people. Firstly, by our board chair, Elisabeth Baugh, and Elisabeth will update you on some changes and some succession planning for our chair and vice chair roles for the board that will take place in December. I'll share some plans with you for the next couple of years for the coalition, but we also thought this session really just offered an excellent opportunity to highlight some of the work that our partner organizations are doing. So we're just really delighted to be also joined today by 3 organizations, one from the US, one from Portugal, and one from Finland. And they are the Amy Krouse Rosenthal Foundation, MOG, which is from Portugal, and the Gynecological Cancer Patients group from Finland. So we're just really looking forward to hearing about your work and what you'll be doing. So Elisabeth, I don't think really needs an introduction, but in case there is anyone here today who doesn't know her, she's been a force to be reckoned with in the global ovarian cancer movement, including through her work with Ovarian Cancer Canada, as CEO. So she's really been the heartbeat of the coalition since day one. So this year brings Elisabeth's role as chair of the coalition to an end, and I think I speak for everyone here when I say, thankfully, Elisabeth will remain an active member of the board. But I wanted to take this opportunity, Elisabeth, on behalf of everyone, and also to personally thank you for everything you've done for the coalition and the global ovarian cancer community. It's been an honor to work with you in that capacity. So on that note, I'm going to hand it over to you and let you share some of our board plans for the coming year.
Thank you so much, Clara. And I have to say, it's been an incredible privilege to have had this opportunity in my career. As I said in my opening remarks yesterday, this partner meeting has been a long-standing ambition of all of us at the coalition. As one of my last official duties as chair, I can't think of anywhere else that I would rather be. I've been lifted and inspired by what I've heard over the past 2 days, and I feel so confident that this will be the first of just many, many future annual coalition partner meetings. This achievement belongs to all of us. The seeds of the coalition and this event were planted many years ago. I have fond recollections of meeting my amazing advocacy colleagues at international conferences and gatherings over cups of coffee and tea, and yes, maybe the occasional glass of wine. We talked about how much we needed a global ovarian cancer awareness campaign and how we could see right before our eyes the immense value of working together as a global network of patient advocacy groups. Those informal meetings over breaks, before and after meetings, in conference hall passageways and late night dinners resulted in 30 organizations signing up for the very first World Ovarian Cancer Day in 2013. As we head into our 10th campaign, I am so proud to say that we have almost 200 patient advocacy partner organizations working together towards our common goal. We could not have made it past that first day campaign without our founding sponsor, Roche, who believed in our dream and stepped in with support. We would not be heading into the 10th campaign if Roche hadn't been there for the first, and if all of you hadn't joined us also. We've worked so hard since 2013 to make this coalition a success. We have been fortunate right from the start to have exceptional global patient advocacy leaders as part of the original steering group and then on the board. These include Alison Coughlin from Australia and US-based Kalanick Balas, both of whom were part of the group that came together around the World Ovarian Cancer Day 2013 launch and whose DNA is baked into our work still today. Current board members, Amlyn Jones, OBE Vice Chair, Tammy Brown, Treasurer, Jane Hill, Robin Cohen, and Eva Schumacher-Wolf have all done so much to help shape and steer this organization to where it is today. We have benefited from your significant expertise, vision, and passion. To this board, I say you've made my job as chair easy, and I've loved every minute of working with you. As a board, our intention has always been to ensure that we reflect the geographical and cultural diversity of the organizations with whom we work. Because of that, I am especially delighted today to formally introduce our 2 newest board members, Runsi CW Chidibe from Project Pink Blue in Nigeria, and Rafe Sadnan Adel from cancerboard.net in Bangladesh. Both Runsi and Adele are passionate advocates for women and founders of patient advocacy organizations in their own countries. They have formidable expertise of global health issues, and their voices are adding valuable insight to our board. The warmest of welcomes to you both. We have already seen from both of you how you can make our coalition more impactful. In December, at our AGM, we will be confirming the appointment of the incoming coalition chair and vice chairs. It's my great honor to share with you today, as Clara mentioned, that the incoming World Ovarian Cancer Coalition chair is Anne Jones, OBE, and CEO of Target Ovarian Cancer UK. And the incoming vice chairs are Robin Cohen, CEO of the US-based Sandy Rollman Ovarian Cancer Foundation and Vice President of Ovarian Cancer Research Alliance, and Jane Hill, CEO of Ovarian Cancer Australia. Anwen has served as vice chair of the coalition since 2016, and Robin and Jane have been members of the board for a number of years. We could not hope for a more experienced and committed leadership to take this coalition forward. Congratulations to you all, and I am thrilled that I will get to continue to work with you, and I'm 100% confident that under your direction, we will reach new heights. This global community has accomplished so much in a short time. I'm excited by the possibilities that lie before us, and that we will have the opportunity to do even more to ensure that every woman diagnosed with ovarian cancer has the best chance of survival and the best quality of life possible, wherever she may live. With that, thank you. And I'll turn it over to our CEO, Clara MacKay, who will take us through some of the specific plans we have for our 6th year and beyond.
Thank you all. So thank you, Elisabeth, for that introduction to the board. I think it will be a really formidable team really to be working with, and we're all very excited. And I'm excited to share with you today our plans for the next couple of years and some thoughts about where we might go from there. But first, I thought it would be just helpful to briefly reflect on some of the highlights that we've met over these past 5 years. And there have been some real standout moments for sure, including the inspiring level of growth and engagement and participation in World Ovarian Cancer Day. The publication of the Every Woman study in 2018 was a milestone moment for the coalition, and the launch of the Global Ovarian Cancer Charter in 2021, and then more recently, the launch of the Every Woman study in low and middle income countries. So it's been a really an accelerating time for the coalition and the work that we do. But of course, our partnerships as well, they have brought so much to us, and these include IGCS, Engage, and the Global Cancer Networks Coalition. The coalitions network is a group of 9 cancer coalitions from around the world that have came together initially around COVID, but whose value extends so much more beyond that issue. So we've spent a lot of time this past year thinking about how we can make sure that we contribute in a way that is as impactful as possible to the global ovarian cancer effort. And this process has made us think about our commitments to patient advocacy and to you, our partner organizations. So we feel and we remain committed to a role to provide more evidence in relation to the experiences of women and what's happening globally for ovarian cancer around the world. We know that that drives policy and action, and we can make a useful contribution to the evidence base. We ourselves, and we know everyone in this coalition, really feels the need to have opportunities to ensure that we're up to date on current ovarian cancer developments, whether that be treatments, science, and policy. It is empowering for us all. We feel as a coalition, there may be opportunity for us to invest in on-the-ground projects. So being able to support work that maybe comes out of the Every Woman study in low and middle income countries, or other pieces of work that are linked to our charter goals. And we especially see a role for us in helping to support the establishment of patient advocacy groups where none exist, or to strengthen the role of those organizations on the ground where they do. We'll continue to seek partnerships and collaborations that bring additional value to all of our work. We'll be hoping in the coming year, now that perhaps we have bit of a break from COVID-19 to be able to start to look to create a medical and policy advisory board for the coalition. But mainly we want to make sure that we're relevant to all our patient advocacy partners, wherever you are in the world and whatever that means for you. And of course, we believe that we need to be accountable to our commitments and to our community. So we're committed to measuring the impact of our work. Our work plans really fall into 3 buckets, and each of these work streams is as important as the other. So our work around supporting our patient partner organizations, providing resources and tools, making sure that we're signposting and showcasing back the brilliant work that we do, providing opportunities to network and engage. Our evidence and advocacy work is about new research that sheds light on the experiences of women with ovarian cancer and those that care for them. But sometimes it also involves collating existing research so that we can put it in a global context. We have seen yesterday the brilliant work that Ovarian Cancer Canada did with their national version of the Every Woman study. We want to support more of that work. And we definitely see that through that we can support emerging ovarian cancer patient advocacy movements. Raising awareness, this is really where we started from. We remain committed as ever to World Ovarian Cancer Day, but also to developing our activities that are about year-round awareness raising. And we have a fundamental call for action that's bedded into our charter, which is about the need for ovarian cancer to be recognized as a global priority. So interesting, we had asked you as part of registration for the meeting what you wanted from us. And what came back to us, I think, really lines up very closely with our ambitions and the work that we do. You said you wanted more networking opportunities, more access to training and skills, more scientific and clinical updates. We have feedback about an interest in advocacy training and requests about whether we would think about research and grants to support activities on the ground. And again, really a lot of support for the work that we do around raising awareness. So we're very encouraged by that. Our 2022 and 2023 and beyond really plans build on the foundation of the Global Ovarian Cancer Charter, and it is underscored by our belief that no woman should be left behind in the fight against ovarian cancer. Some of our projects, so looking at some quite specific projects that we'll be doing in the coming year. We've talked a lot over these last 2 days about our Every Woman study in low and middle income countries. We're doing that in partnership with IGCS. We hope by the end of this year to have some preliminary results, but in reality, that project I think will run into 2023, and we have some thoughts already about how we could take that forward and create a program of activity around that. We're just starting to talk about, there's much work to do in terms of scoping, but we want to do in the coming year, and again, this is probably a multi-year project, a futures exercise. So we want to look at what people feel is the future for ovarian cancer, whether that be 3 years, 5 years, 10 years ahead. And this is really about consultation with the community, the expert patients, the expert patient advocates, the clinicians, industry, anyone with an interest in and an involvement in ovarian cancer. And so we also hope that come next year for this meeting, which will be in November, that we'll be able to share some of those preliminary results. We're very excited about this development, and we're very keen to involve the community in it. Inclusivity, we are committed to working in a way that reflects the diversity of all who are impacted by ovarian cancer. So we say this is actually as much about a process about how we work as it is about a particular activity or output. But we will be creating content and resources that we think will better serve the needs of the LGBT community. And we are taking advice and consulting with health and advocacy experts from that community to ensure that we're doing this work well. And we know that the workshop that we are holding around inclusivity has been extremely popular and well received. And we are committed to doing a very specific campaign around in June 2022 to mark Pride Month. The 10th World Ovarian Cancer Day, that is obviously something that's near and dear to our heart, and really is at the it is the cornerstone of everything we do around awareness. Last year, we exceeded all expectations. We reached over 18 million people directly and 100 million indirectly. We have developed, and we shared this yesterday, our theme for the next 3 years, actually, which is No Woman Left Behind. So we're really excited. We got some great feedback on our proposals for that campaign, and we believe it will enable us to have an even bigger and better global community around the day campaign. And to the point where people have asked for more networking opportunities, more opportunities to discuss and consider advocacy issues together, we will be running over the course of the year a number of what we call think tank events. Our first one will be in March 2022. It will pick up from the treatment mapping project that we presented yesterday. And these think tanks are really about more solution focus. What can we do practically as an ovarian cancer community to really tackle some of these issues? We also know we work with many organizations, and many of our partner organizations are women's health organizations, gynecological cancer organizations, and mixed generic cancer organizations as well. So what we want to do, and through the conversations that we've had with these organizations, I think we all can see that there may be opportunity to collaborate around women's health and actually support all of our efforts in each of our areas. Of course, and our second annual meeting is already being planned. Our proposal is that we hold it in November next year. It will be virtual. We feel that in many ways that enables us to engage with a much larger population. So we will stick with the virtual model for now, but we will for sure come back to meeting in person. And we'll use that meeting to update you on our activities. But also, I think we will include a much more significant element of that program that will involve our partner organizations. So before I introduce our other guests, I just wanted to say thank you from our team. Frances Reed, who's Director of Programs, Phaedra Charlton, who's Director of Communications and Marketing, and our most recent addition to the team, Emma Carey, who is our Project Assistant. Thank you. We really appreciate all the support that we have received from you. And that's I'm going to stop there. So those are our plans. Really happy to talk to you more about them and answer questions. But I think what we're going to do now is move on to our guests who are going to share their plans and activities for the coming year or so, and in terms of where they are and what they're doing. And I think we're going to start with Betsy Katten, who is from the Amy Krouse Rosenthal Foundation. So Betsy, if I could hand it over to you.
Great, thank you. Oops, sorry. Hi, everybody. So honored to be participating today from Chicago, Illinois. I'm the executive director of the Amy Krouse Rosenthal Foundation. So who is Amy? Amy was a person who liked to make things. She was a very prolific, best-selling children's and grown-up book author, TED Talk, made films, had all kinds of projects. She wrote over 40 best-selling children's books. And she put a public face to end-of-life decisions and ovarian cancer shortly before she passed away in March of 2017 with her viral essay that was in the New York Times titled, "You Might Want to Marry My Husband." And that was read by the time she died, 10 days later, by some 5 million people, and continues to be one of the most read essays in the modern love section of the New York Times. Her husband, Jason, wrote a response a year later that was a follow-up. "My wife said you might want to marry me." And he also, a book by the same name was published last year. So Jason formed the foundation in Amy's memory in March or April, shortly after she passed away, 2017. And the foundation, I think we're a little bit unique, I'm guessing, from other community partner organizations, in that we have a dual mission. So we are providing funding for awareness and research for the early detection of ovarian cancer, as well as working on child literacy efforts. Those were two causes very important to Amy, hence the dual mission. It makes it complicated and challenging because we split our resources, but we are able to attract a wider audience because we have a lot of teachers and literacy folks that are also going to see our messaging on ovarian cancer, and we have people that come to us for ovarian cancer that might also learn a little bit more about our efforts on children's literacy. So for now, at least, we're staying with both missions, although we can, from the beginning, it's been an issue for us, a question of whether or not it should just be singular focused. So the foundation, as I said, was formed in 2017. I came on as the executive director at the very end of 2018, and we really got going just in 2019. We became a community partner of the World Ovarian Cancer Coalition in 2019. So we're really only about 2 years in. In that time, on the ovarian cancer side of our mission, we've been funding early detection research through the Foundation for Women's Cancer, which is the philanthropy of the Society of Gynecological Oncologists here in the US. They have a award program. We went through them because we've tried to keep our organization, I'm the only full-time employee. We're very lean. We want as many dollars to go to our mission as possible. And we decided that they had this really unique, interesting program that we would use their amazing research scientists to assess where to grant the money or where to grant our funds, and we wouldn't have to have the administrative costs of having our own board. So especially because we're starting out, that's the way that we're structured at this time. I don't know that, that's sort of the last 2 years we've given our largest grants through the Foundation for Women's Cancer. If you're not familiar with their award program, they provide seed funding to young investigative researchers that are starting out. They have a 23-fold return on that investment, then on getting larger grants from bigger institutions once they have proof of concept. So we thought that was a good thing to do. This year, we're going to be giving actually almost as many funds or even more to the University of Chicago, to their research institution on ovarian cancer. And we've also made additional grants elsewhere, but primarily we've been funding through the Amy Krouse Rosenthal Foundation early detection research grants through the Foundation for Women's Cancers programs. Again, our main focus is on the early detection side. The board at their very first meeting decided that there were so many organizations looking at what everyone was doing that was an area where they wanted to focus and felt that awareness and research in that area for the dollars that we felt we would have could be most impactful. These are the two researchers that we're supporting that are in the current cycle. And you can see Dr. Baugh is doing early diagnosis of ovarian cancer utilizing epigenetic changes in cell-free DNA. And Dr. Corvigno at MD Anderson in Houston is doing early detection of high-grade serous ovarian cancer via metabolic analysis of circulating platelets. Our goal with both studies, finding a non-invasive early detection test. And then this, we supported last year, Dr. Rebecca Porter, MD PhD at the Dana-Farber Cancer Institute, whose study was on repeat RNAs as novel biomarkers in high-grade cancers. So she finished her cycle with us just in July. Her research is obviously ongoing, and I'll talk for a moment when they asked, how COVID has impacted our organization, and her research was definitely slowed down during the period because the grant started really in the spring when COVID first hit. Other ovarian cancer programming, we do a lot of awareness activities on signs and symptoms. You can follow us on social media. We're posting there. We work with other community partners on awareness and education programs. So one of the things that just came out of the last, earlier in this presentation was kind of working with other organizations. And you know, I know that everybody kind of with COVID switched to Zooms and webinars, and there's so much education programs. And I didn't feel that our best dollars were spent doing what other people were already doing. So I've certainly promoted an organization, Tina's Wish, which has an early detection focus. Their seminars, the Foundation for Women's Cancer has seminars, you know, whatever or other organizations are doing. I think that one of my beliefs is that we don't need to compete with each other, and kind of supporting our other partnering organizations. If you're putting on a great seminar, I want to tell people about it rather than having to put on, you know, taking the resources to put the exact same seminar on just to put my logo on it. We've also done a lot with the World Ovarian Cancer Day. We had the last 2 years virtual yoga experiences because Amy's sister was a yoga instructor, and we worked in inspirational quotes, and it was just voluntary, and we raised a little bit of money through it, but more wanted to recognize the day, bringing community together. With all that was going on the last 2 Mays, we did that virtually, and it worked over Zoom and over Instagram, and it worked out great. Key challenges, obviously, I don't need to tell you all about the early detection side of things. So we're working on getting people to know what those signs and symptoms are. So we're going to continue at this stage to focus on early detection, research, and awareness. And as I just said, I think I'd love, you know, it's really important to me to be a part of this organization because I think there's so much benefit to be gained from bringing different ovarian cancer organizations together, coordinating efforts and resources. And my strong belief is let's not, you know, use what we can use from each other and have the dollars go to research and help patients. We were asked about the impact of COVID. So some of our research studies were definitely slowed down. We obviously do fundraising to sponsor the research, and all in-person events were canceled. We've moved to virtual events. We have been contacted by patients who obviously with everything that was going on were delayed in getting treatments or seeing doctors. I think that was very common over the last year and a half. And then, you know, fundraising, we had a lot of concerns with what we would be able to do in 2020 due to the economic uncertainty. Our plans for the future, we're continuing. So we have, as I said, we've committed to another grant through the Foundation for Women's Cancer, at least one next year, possibly 2. That decision will be made this month. We're continuing awareness activities, and we just like to continue, you know, being part of this community and building and sharing more stories. I think the stories are really impactful when we share those. We had a couple up this week on our Instagram, and I think that's really the best way that we can bring attention is to personalize it. So we're having our big events. We do one major fundraising event a year. I think next year we'll probably try to increase that to at least 2. And as I said, I think we're a young organization, and I was so surprised that we were asked to present because we're so new. But I think, you know, we're going to do some, now that we realized, okay, we can do this, we can be impactful, we're funding grants. Our next issue is really looking at some strategic planning we're going to do in November about what we want to do and where we want to be over the next few years, and what that growth should look like. So I put the website up here where if you'd like to learn more, you can join our Yellow Umbrella Party on October 14th. We'll be having a benefit. You can register for free and learn more about the organization. And these are where you can find us on Instagram and Twitter and Facebook. And I'm not on TikTok, so just gave up at that. And our website, but I just thank you again for this opportunity, and thank you to all of you for everything that you all are doing to help in this cause as well.
Thank you, Betsy. Actually, a couple of things. I have some questions, but we'll come back to them at the end. But two things. One, like you, I have had to abandon TikTok. It's just one step too far. But I absolutely love the theme of collaboration and using the expertise and resources in other organizations. And the questions that are coming in are really interested in that. So I think you're being a new organization is really interesting, and your approach to it and strategy, I think people are very interested in. So we definitely have some questions for you around that. But I think now we're going to turn to Claudia Marques and Claudia Fraga from Portugal, from MOG in Portugal, and you're going to take us through. Welcome, really lovely to see you both, and thank you for joining us. We're really excited to hear about your plans. So I'll hand it over to you.
Hello, everybody. I'm Claudia Fraga, president of MOG, and Claudia Marques she's going to speak about us.
Hello, everyone. It's really lovely to be here. And just before anything, and first of all, I'd like to thank our hosts for this amazing opportunity and for the virtual partner meeting, which is just an excellent idea to kind of break the barriers and get us all together as patient organizations and collaborate. Again, it is a common goal for all our organizations is to collaborate, and that's how we will be better and we will beat this. So this is really, as I said, a wonderful opportunity, and it's also a great honor for us to be here. I wanted to talk to you a little bit about MOG. So MOG stands for Ovarian Cancer and Other Gynecological Cancers. So it's a not-for-profit organization and was founded on the 18th of December 2019. And as we all know, shortly after that, the pandemic began and lockdown took over in March. And we always say that, Claudia and I, that despite all these difficulties, so we never gave up, never ever, and we never resigned. So we used to say we confined, but we never resigned. So a lot of work has been done since then, between mostly Claudia and myself. Most importantly, we have effectively helped many women. There was no other organization for ovarian cancer or gynecological cancers in Portugal, so we were the first ones. That's why we felt the need to create this organization, to voice women's concerns and their needs. So we found as well that there were women who needed advice and signposting to relevant doctors and services. I would like to speak to you a little bit about our mission and the main reason why we exist. So the first point was, and that we found that there was a gap there that needed to be addressed, which is improving the quality of life of all these women dealing with this disease, and as well to raise awareness. Raising awareness is, I know it's the new word on the block, but it's so important to have it out there, to voice the concerns, to just stress it. It's never enough just to stress this, how important it is to pass the word on. So the impact that this type of cancer have on the lives of not forgetting the patient, but also their families, their friends, and again, it's important to cooperate with the various entities to ensure that the diagnosis, the treatment, and monitoring of the community. So through this concerted strategy and plan of actions, we also created a plan of actions. The founding members of MOG want to help empower. So we want to give, I think empowerment is a very important attribute here. We need to empower the community of patients, of women with gynecological cancers in Portugal. And this is, it may be as well a cultural problem. This has to do with the fact of patients in Portugal being, how shall I put it, quite submissive. It's probably a strong word, but maybe the right one, because they're not used to asking questions. And that's why for us, it's a challenge to try to explain that they need to ask questions in order to be happier people and to find out what options they have available. So basically to empower, and especially more vulnerable groups, such as people without economical means, and also people without technical knowledge and access to technology, because we still have some margin group of people who may not have access to that. So I want to share with you now our main objectives and the objectives which are composed with the global mission of MOG. So our first objective is to provide support to women diagnosed with ovarian and other cancers, families, and healthcare professionals. So we say here healthcare professionals because we want to have an excellent relationship with them. We want to gather contacts of all, most important stakeholders, because that's what they are to us. We need to work with them, and they need us as well. So we need each other. So we want to get a database of all these health professionals who will work with us at MOG. The second objective is improve the quality of life by cooperating with, again, various entities, and that includes as well, of course, you guys. So patient organizations, including authorities, public authorities as well, who could help us pass on our message. The scientific community is a very important stakeholder as well, and we have also created bonding with them. So we need to create this bond to ensure that proper diagnosis and treatment for our community. Our third objective is to raise awareness. Again, how important. So sorry, the second one, I just jumped there one. So second is improve the quality of life. Third one, raise awareness about this impact. And the population in general. So what we want to do here is to have a close relationship as well with the media. So which is the best way to send the messages out there. And so what we've been trying to do, and Claudia has been doing a great job at this, which is communicate with local TVs and radios. So we've done some radio shows, newspaper interviews. So we try to keep in contact with them and to promote our voicing our concerns. We also increase the visibility and the public recognition of this cancer. We promote public education about gynecological cancers and the impact that it has on the quality of life. And with public education, what we mean is we want to reach schools. So we want to go out there. One of our big projects for this coming year is to create video, a professional video, which will have impact at schools. So we want schools to screen these videos. We want to make sure to kind of be part of their program at schools. So to raise awareness, because who better than our children and young adults to hear this message. So they are the best ones then to pass on the message to they are our future. So the fifth objective is to promote to promote early diagnosis as well. This is very important, as we all know, and we've spoken here as well before. So early diagnosis, the referral, we want to help women with second medical opinions, which are scarce, and some women don't have the energy or the help they need in order to access. So we want to give them that treatment, control, and of course the multidisciplinary prevention of this disease, and also also onwards. So after the diagnosis, so we need to get this multidisciplinary approach with, for example, psychologists, with social workers, to involve this community to help our women and their families. So we want as well to motivate the introduction and access of new therapeutic options. So necessary conditions to promote, control the quality of life, and particularly, again, as I mentioned, for people with more limited means and access to information. So we want to promote the educational, social, and cultural scientific actions around gynecological cancers. And as I mentioned, so to promote our cause in the social media, so with interviews on TVs, radios, and newspapers. We want to increase the interest for and collaborate in research. Research is also very important in technological development and innovation. We want to cooperate with similar associations and other national and international entities, so we can share information, share best practice, experiences, and to have our aims, our objectives to be concerted, and so that we can all strive, towards the same direction. We want to promote the contact and articulation between people and families with gynecological cancers, with health professionals, researchers, and policymakers. So we're trying to get all these people together, try to get them to speak to each other, so that we provide, in a way, this is to have the best service possible we want to achieve. So I want to share with you now information about a study that we carried out together with the support of GSK, GlaxoSmithKline, and it was the first ever study in the history of Portugal, which was about ovarian cancer in Portugal, and it was about knowledge and perceptions of ovarian cancer. So there were some really kind of screaming out conclusions there, which I want to share with you guys. And it stated that increasing literacy and regular visits to the gynecologists are the only ways of preventing ovarian cancer. And the conclusions of this study were that more than 90% of the Portuguese population believes that COVID-19 pandemic is causing delays in the new ovarian cancer diagnosis, as we have it all across the world, I'm sure. 79% of people are aware that ovarian cancer exists, but know very little about the disease. 79%, it's a lot. Namely, about 85% report not knowing the symptoms, so which is also kind of worrying, and more than 35% do not know the risk factors, and about 84% do not know the average age of diagnosis. 18% of women report that they do not have any specific behavior to prevent ovarian cancer, and about 24% do not have regular gynecological medical checkups. About 44% of women who do not regularly attend a women's health appointment say they don't do so because they don't feel the need. It's not a question of feeling the need, we say, because when you go, because you feel the need, it's often too late. And we know that. In terms of knowledge of new cases, so more than 67%, they say they have no knowledge of new cases of ovarian cancer, and around 30%, they don't know the survival rate. So every year in Portugal, around 600 women are diagnosed with ovarian cancer. Around 400, they do not survive. So time is of the essence, and we should all have access, and I'm sure you'll join me in saying we should all have access to specialized doctors, innovative therapies, medication that obviously will likely increase life quality and expectancy and will help prevent recurrences. It is vital to bring clinical trials into Portugal, because it's not something that is still part of our culture. So we are striving to bring clinical trials here. We need to increase the knowledge of the population about this cancer. This is our fight. And there's so much more we can do, and we need each other. We do need each other, and we can only be stronger, of course, if we work together. So thank you again for this opportunity. Thank you, Clara.
Thank you so much for presenting that. So interesting. I'm going to move on right now, though, we'll go to Eva-Maria Strömsholm's video, and then we'll have a little time for questions because there's so much in there. It's so interesting.
My name is Eva-Maria Strömsholm, and I'm representing gynecological cancer patients in Finland. And our association is really new. It's founded in February 2020 by the request of gynecological cancer patients. And gynecological cancer patients have not previously had their own association in Finland. So therefore, it was really important for this association to be founded. The association operates on a voluntary basis. The majority of the board members of the association are gynecological cancer patients, and that's really important to have a lot of them who knows about to be sick. And our association is also nationwide and bilingual. We are in Finnish and Swedish. And the association emphasizes the prevention and the early detection of gynecological cancers. Our association has a goal is to improve the quality of life of gynecological cancer patients and to develop their rehabilitation. We have also peer support, and this is really important to our association and our members. We coordinate 4 patient networks and peer support groups via Facebook. They are for patients with chronic gynecological cancer, and they discuss about their illness and how they will cope and such kind of things. They are really, really active. And then we have a peer support group for young adults with gynecological cancers. They are also quite active, and they have different kind of problems and discussions. Then we also have for those suffering from infertility due to gynecological cancers. And this was a wish from a young woman that they want to have an own group that they can discuss about those issues, because it's hard for them to discuss with others who don't have the same problem. And the 4th is for Swedish-speaking gynecological cancer patients, because in Finland we have 2 main languages. And then we have had peer support groups via Teams in the spring and also now in the autumn. We have been making fact sheets, special fact sheets for patients. The one is gene tests, BRCA tests, and the 4 others are engage own fact sheets, but we have been translated them to Finnish and one into Swedish. So those are, what would you ask your doctor? then about HPV vaccination, lymphedema, and psycho-oncology. We have also spatial activities this year. We had done a rehabilitation survey, and 105 answers we got. Patients had answered our survey, and we want to get through to people in the hospitals and the decision makers that we don't have the rehabilitation plans, or the people, the patient and the woman don't have the rehabilitation plan, even if it is really important and it's written in the law that we need to have it. So just 90% didn't get the rehabilitation plan, and 6 didn't know if they have got the plan or not, and just only 4% did got a plan. We have had a small campaign for World Ovarian Cancer Day with information about ovarian cancer and its prevention, early diagnosis, and different treatments. Also World Go Day we had this year and last year, and we have included sport activity challenge. And then of course in the spring we had the HPV campaign, who was really a success. Then we have plans for 2022. We will do a survey for association members to ask them what they want from us, what do they wish. And already we have planning a webinar about fatigue, because many patients told us that they don't know about the fatigue, and the doctors don't know about the fatigue, and it's a really big problem for many gynecological cancer patients as well. Then of course World Ovarian Cancer Day, and another webinar next year about immune oncology treatments. And we will have a World Go Day and a project developing peer support for young adults. And I will mention some challenges in Finland. We have about 1,900 women getting gynecological cancer in Finland every year. And some challenges for the advocacy of gynecological cancer patients are late and long-term effects. They aren't known and treated good enough. And only few % of patients has the rehabilitation plan, as I mentioned. And nationwide and regional coordination of rehabilitation is poor. It could be really better. And small population with own languages isn't popular place for big international studies. So the clinical trials are a big challenge also. And long process for getting new medicines is a challenge in Finland. So this was short about our association. We are really new and we are really excited. And in our board, we have quite good members, both nurses and other, and patients who will go forward with this association and try to do our best for the patient. And you can find us here in the website and email us if you have some questions. So I will thank you for this time, and please contact us if it's something you want to ask.
Thank you so much. All of those, we really didn't pick these 3 organizations because they were new, so it's a coincidence, but I'm really interested in it, and I think everyone can see there's so much we could learn from it. We have about 7 minutes for questions, so I think what I'm going to do is consolidate some of the questions that have come in and really distill them down into 2 points. And one would be, I put to all of you, I'll start with you, Betsy. As a new organization, and I love that you're thinking about your strategy and focus, I think that's absolutely right. But what would for someone else who's taking on a new organization and kind of building it up from scratch, based on your experience, what advice would you give them?
I would say to try to be as focused as possible, see what's missing in your community. So there was no organization like ours actually in Chicago, even though it's a major, city, for the World Ovarian Cancer Coalition, for example, or the OCRA did not have a Chicago community partner. And I was really surprised when I realized that starting in 2019. And we were a small organization starting out. Are we going to be able to fundraise? What will we be able to do? We can't conquer all this. We're not going to be the National Ovarian Cancer Coalition. We're not going to be the OCRA. What impact could we make at a beginning level? And we decided that was to focus on early detection. And then I think try and build second, once you have that focus, and we're more on the research side of things, but then trying to focus community and just re-engaging with everybody to keep people, attached to your organization and listening to your message.
Excellent. And the two Claudias, what would your advice be to, you guys started, really, there's nothing else in Portugal, so really amazing what you've done, but what would your advice be to others who are thinking of doing the same, taking that same leap and setting up an organization?
So I don't know if Claudia, do you have it here? So in my view, I think you need to have, first of all, love for passion, for what you're defending and what you're representing. And of course, then it's gathering important contacts between, and all to do with the medical associations and so on. So with other organizations as well, establish partnerships is so important at the beginning, because we can't do this on our own. And so that's why we had to find as well sponsors. So that's very important for someone who's beginning. So they need to define, to have a very good definition of what the mission is, and a strategy, and then present that to the sponsors. And also Claudia was giving me the idea as well, and it was what happened to her. So she joined a training course on development for patient associations, and it's a training course given at the University of Lisbon. So it's organized by them, and it's the public health school, it's called.
Okay, that's really interesting. Thank you. And Eva-Maria, to you, you're also a reasonably new organization. What would your advice be to someone trying to do a startup like you?
Yeah, I could say the same as Claudia said, that to have the passion, to have the right people with you, to know what you are going to do, to have a goal, to have sponsors, to have collaborations. So I think you need those kind of things to have strength to do it and possibility to do it.
Thank you. And while we're with you, one other question. If you can think of something, what could we do to help you? Is there something, the support that we might provide as a coalition? Are there specific things?
Mm-hmm. That's a good question. I think you help us already because you have good webinars, so we can attend at those and learn more. And I think it's good to have the collaboration and to talk to each other and get new ideas, because of our association is so new. So we need ideas, and then we can do it in our own style, in our own country.
Yeah, it makes me feel like a webinar around this sort of issue would be really helpful.
Yeah.
And Betsy or Claudia, what are there things that, you think, wow, if the coalition did that, that would be really helpful for us? Betsy, maybe?
Yeah, I agree with what was just said. I thought with the World Ovarian Cancer Day campaign this year, I thought it was great how you had the images and just pick the one you want, and and things so easily to do social media, because that actually, for something so simple, and whether or not you're not sure if it's even giving you much return, it can take so much time to come up with that. So I thought that was really a great effort that you all did. And I think, just continued information about what other people are doing that you might want to share with your community.
Excellent.
So again,
Great.
going back to my point of knowing what everyone else is doing and not having to.
Thank you. Well, it's gone by so quickly, but our time has come to an end. Thank you all so much. And what I would, and we'll have you back. It's just such an interesting conversation. But now I think we're almost ready to start our award ceremony, and we don't want to keep our award recipients waiting. So I want to introduce Robin Cohen, who is our incoming vice chair, who's going to host the awards for us. Thank you all so much, and we'll see you again for sure.